I want you to try and imagine, just for a moment, what it would actually physically feel like if your own body began to slowly turn into a rigid statue.
Yeah, that is a truly harrowing reality to even think about.
Right. Just imagine a disease where your skin and eventually your internal organs just gradually remodels itself into thick, unyielding scar tissue. You lose your flexibility.
Exactly. The skin just tightens right around your joints.
And for decades, the absolute unquestioned consensus from every medical specialist you see is that this process is a one-way street. Like, they might be able to slow it down, but there is absolutely no turning back the clock.
Right. The idea being that the structural damage to your tissues is just permanent.
But today on The Deep Dive, we are looking at research that is actively shattering that dogma. We are unpacking a genuinely groundbreaking May 2026 study published in Nature Communications.
And it's an incredibly dense, fascinating paper.
It really is. Our mission today is to understand exactly how an innovative therapy, specifically CD19-CAR T cells, is being used not just to halt the progression of a deadly autoimmune disease called systemic sclerosis, but to somehow convince the body to actually reverse the structural damage.
Yeah, to actually regenerate healthy skin from the inside out.
Which is wild.
Yeah.
So setting the stage here, the researchers conducted a deep phenotyping study on skin biopsies from systemic sclerosis patients who received this CAR-T therapy, right?
Yes. Some were part of the Castle clinical trial, and others received it through named patient use.
But what makes this study so powerful is how they looked at the tissue. Like, they didn't just put a slide under a standard microscope.
No, not at all. They used cutting-edge spatial mapping technology to track tens of thousands of individual cells.
Wow.
Yeah, reading their RNA and proteins in three-dimensional space. So they are essentially watching these cells rebuild a complex organ in real time.
Okay, to really appreciate how revolutionary this is, I think we need to understand the villain of the story first. We have to understand why the medical community was so convinced that this specific damage was permanent. Let's start with the disease itself, systemic sclerosis, or SSC.
Right. So systemic sclerosis, particularly the diffuse cutaneous form, is just devastating. It actually has the highest case-related mortality rate among all connective tissue diseases.
That's terrifying.
It is. And that high mortality is driven by what we can think of as a triad of pathology. So that's autoimmunity, vasculopathy, and fibrosis.
Let's break those three down for the listener.
Sure. So first you have autoimmunity, where the immune system goes rogue, and starts producing autoantibodies that attack the patient's own tissue.
Okay, the body attacking itself.
Right. Second, you have vasculopathy. That is severe damage to the blood vessels. The capillaries essentially die off, which starves the tissues of oxygen.
And then the third part.
Finally, that continuous damage triggers massive fibrotic tissue remodeling. So the body's repair cells panic and start endlessly replacing healthy, functional tissue in the skin, lungs, and heart with thick, rigid collagen fibers.
I think visualizing what happens to the skin structurally is really helpful here.
Yeah.
If you were to look at a cross-section of perfectly healthy skin under a microscope, the boundary where the outer layer, the epidermis, meets the deeper layer, the dermis, it isn't just a flat line.
No, it has a lot of texture.
Right. It looks a lot like a 3D egg carton. You have these distinct peaks and valleys. The peaks of the deep layer pushing up are called dermal papillae, and the valleys of the outer layer dipping down are the ridges.
That is a great analogy. And that egg carton structure is totally essential for the skin to actually function.
Because it's not just shape, right?
Exactly. Those dermal papillae, the peaks, they aren't just empty bumps. They house these intricate capillary loops that supply blood, and they contain the nerve endings that allow you to feel touch. Yeah, they also provide the structural shear resistance that keeps your skin from tearing when you rub it. But in systemic sclerosis, this entire architecture is just annihilated.
So the egg carton basically gets crushed completely flat.
Completely flat. The blood vessels die, the peaks and valleys completely disappear, and the skin flattens out into what pathologists call a reticularized phenotype. The complexity is just gone.
That sounds irreversible.
Well, and on top of that, the collagen fibers in the dermis undergo a radical change. In healthy skin, collagen looks like a randomized flexible mesh. It moves with you.
Like a net.
Yeah, but in SSC, those fibers start to align rigidly in parallel. It becomes dense and inflexible. And for decades, the medical consensus was that once those papillae are flattened and that collagen is rigidly aligned, it's like a burned down house. You can't unburn it.
But I want to push back on that consensus for a second because it raises a really logical question for anyone listening. We have incredibly powerful immunosuppressant drugs today. We have biologics.
We do, yeah.
So if a patient is diagnosed and we give them standard therapies that successfully quiet the immune system down and stop the autoimmune attack, shouldn't the body eventually try to rebuild that egg carton on its own? Like, why doesn't standard medicine reverse the flattening?
It's a great question, and it really comes down to a crucial distinction in how these drugs work versus where the actual problem is hiding.
Okay, unpack that for us.
So standard therapies, things like mycophenol mofetil or even targeted biologics like the CD20 depleting antibody rituximab, they are very good at quieting the circulating immune system.
In the blood.
Exactly. They lower the inflammation in the bloodstream, but they fundamentally fail to eliminate the deeply entrenched rogue immune cells that have already taken up residence deep inside the tissues.
So the standard drugs are essentially clearing the streets, but they're leaving the bad actors locked inside the buildings.
Precisely. Rituximab, for example, is a very large molecule. It struggles to penetrate deep into the dense fibrotic tissue to reach the rogue B cells and plasma cells hiding there.
And those cells are the problem.
Right. Those cells are the instigators. They sit deep in the skin and organs, constantly pumping out autoantibodies and inflammatory signals. So traditional drugs might quiet the overall systemic noise, but they leave the corrupt foreman right there on the construction site, actively commanding the tissue to keep scarring.
Which brings us to the actual intervention used in this study, which honestly feels like it was pulled from an entirely different field of medicine, CAR T-cell therapy. Specifically CD19-CAR T cells.
Yeah, it's a huge leap to use this year.
Because normally we hear about CAR T in the context of fighting aggressive blood cancers, right? Like leukemia.
Absolutely.
Okay, let's unpack this for the listener. We take a patient's own T cells out of their blood, take them to a lab, and genetically engineer them to express a chimeric antigen receptor, a CIR. We essentially strap a molecular GPS tracker onto the T cell that tells it to hunt down a very specific target.
And then you multiply them and infuse them back into the patient.
Right. But the target here is a protein called CD19. So why are we deploying a cancer-hunting smart bomb against CD19 for a skin disease?
Because CD19 is a nearly universal surface marker for B cells. By programming the T cells to hunt CD19, you are instructing them to eradicate the B cell population.
And in systemic sclerosis, B cells are those corrupt foremen we just talked about.
Exactly. They aren't just innocent bystanders getting caught up in inflammation. They actively secrete pro-fibrotic chemical signals like interleukin-6 or IL-6 and highly specific autoantibodies, such as anti-CL70.
Okay, wait. Anti-CL70, what does that specific one do?
So anti-CL70 is an antibody that targets an enzyme in the cell nucleus. But in the context of SSC, having it in your system is a massive red flag. It correlates with severe diffuse skin thickening and lung fibrosis.
So these chemical signals, the IL-6 and the autoantibodies, they are direct orders to local fibroblasts, telling them to stay in overdrive and keep producing rigid scar tissue.
Right.
And the reason the CAR-T approach works better than a drug like rituximab is because a CAR-T cell is a living, moving entity, right? It doesn't just wash over the tissue, it actively crawls into it.
Exactly. CAR T cells are living drugs. Once they are infused back into the patient, they actively hunt. They multiply when they find their target. And crucially, they can penetrate deep into dense fibrotic tissues where standard antibodies simply cannot reach.
Well, they go straight into the buildings.
Yeah, they go right in and wipe the B cell slate completely clean.
Okay, let's do a really quick bulleted check-in for you listening so we are completely grounded before we look at the results. One, we know systemic sclerosis completely crushes the skin's natural 3D egg carton structure, causing permanent scarring.
Right.
Two, we know deeply embedded rogue B cells are acting as corrupt foremen driving this. And three, CAR-T cells act as a smart bomb to penetrate the tissue and wipe out the B cells completely.
Perfect summary.
So that brings us to the fundamental question of the paper. The TRT cells have done their job. The B cells are gone. The bad signals have stopped. What happens next? Does the body just sit there with flattened, scarred skin? Or does it somehow know how to rebuild the egg carton?
This is exactly where the researchers had their massive aha moment. To answer that, they took sequential skin biopsies from the forearms of these patients at 1 month, 6 months, and 12 months after the ERT cell infusion.
Okay. And what did they see?
Well, when they looked at the tissue under the microscope, they saw what the textbooks say shouldn't happen. The dermal papillae, those complex 3D peaks, actually grew back.
Wait, really? It is genuinely incredible to think about. Tissue that had turned into a rigid sheet was somehow structurally reforming itself.
That's unbelievable.
But how significant was the regrowth? Are we talking about a slight bump? or a real structural return?
A very real structural return.
Yeah.
In one of the patients detailed in the paper, the height of the dermal papillae increased by up to 2.4-fold by month 12.
2.4 times.
Yeah. The epidermis and dermis were literally reaching back into each other to rebuild that functional interface.
That's incredible.
And perhaps even more surprisingly, it wasn't just the shape of the boundary that improved. Remember that rigid parallel alignment of the collagen fibers that causes the skin to become so tight?
Right, the rebar that gets laid down the wrong way.
Exactly. The researchers used a metric called the curviligne score.
Curviligne score.
Yeah, it quantifies how dangerously parallel and stiff the collagen matrix is. After the CAR T therapy, that score dropped significantly.
So the collagen had actually unaligned.
It did. The tissue began actively remodeling itself back into a healthy, randomized, flexible mesh.
That is fascinating biologically, but I want to connect this to the actual human being sitting in the clinic. If you are a patient living trapped in this rigid body, what does this cellular remodeling actually feel like? How does it translate to your daily life?
Well, the clinical impact is profound, and the paper tracked this meticulously. The rheumatologists used something called the Modified Rodnan Skin Score, or MRSS.
And that measured what?
They use it to manually grade skin thickness and stiffness across the entire body. And following the CAR T therapy, those scores just plummeted, meaning the patient's skin physically softened and became pliable again.
Oh, that must be such a relief.
But perhaps the most tangible relief came in the form of massive improvements in Raynaud's phenomenon.
Right. Raynaud's is a classic symptom of the vasculopathy we mentioned earlier, where the blood vessels in the extremities are so damaged and hypersensitive that exposure to even mild cold causes them to clamp completely shut.
Exactly. The blood flow to the fingers essentially turns off. It is incredibly painful. The fingers turn white or blue, and it can lead to tissue death or ulcers.
That's horrible.
But after this treatment, the patients reported that both the intensity of the pain and the actual duration of those Raynaud's attacks dropped drastically. The physical remodeling of the tissue was restoring proper function to the limbs.
If we connect this to the bigger picture and look at the underlying logic of what's happening here, it's profound. The total eradication of the B cells didn't just hit a pause button on the disease. By removing that toxic pro-fibrotic environment, the treatment proved that the adult human body hasn't forgotten how to build healthy skin.
No, the blueprints are still there.
Right. It has these complex regenerative programs lying dormant, and once the interference was silenced, it woke up and remembered how to heal itself.
It is a total paradigm shift.
What?
But it immediately demands an explanation. Seeing the papillae return under a microscope is amazing, but how is the tissue physically executing this rebuild?
Who is actually doing the work?
Exactly. If the B cells were the corrupt foremen shouting orders, who are the construction workers actually tearing down the bad collagen and laying down the new structure?
Well, the heavy lifting is done by the fibroblasts, right? They're the specialized cells that manage the extracellular matrix. They build and maintain the structural scaffolding of our tissues.
That's right.
But to figure out exactly what these fibroblasts were doing during this recovery, the researchers had to use some incredibly advanced technology, because you can't just throw the biopsy into a blender, extract the chemicals, and see what's there. That would tell you what materials are present, but it wouldn't tell you where they are or who is making them. You need to see the cells in their actual neighborhood.
Precisely. You need geographic context. To get that, they used cutting-edge cyclic in situ hybridization, or cISH, and imaging mass cytometry, or IMC.
Here's where it gets really interesting. The data density is just mind-blowing.
It really is. Instead of a blender, imagine having a highly detailed Google map of the tissue where you can zoom in on a single microscopic house and see exactly what the people inside are doing. They mapped over 74,000 individual cells by reading their RNA transcripts right there in the intact tissue.
74,000 cells.
Yeah, and another 53,000 cells by looking at their exact protein expressions using specialized lasers and metal-conjugated antibodies.
I want to make sure we don't get lost in the lab techniques here. The core concept is that they were able to look at the living map of the skin and identify every single fibroblast based on the specific genetic instructions, the RNA it was currently reading. And by doing that, they noticed a massive shift in the type of fibroblast present.
Exactly, because fibroblasts aren't all the same, they adapt to their environment. In the disease state of systemic sclerosis, the map is heavily populated by bad construction workers.
The ones making the rigid collagen.
Right. These are pro-fibrotic myofibroblasts, cells that are essentially stuck in overdrive. And the researchers identified them by specific genetic markers. Specifically, they were FAP positive and COL8A1 positive.
So FAP and COL8A1 are like the specific uniforms these bad workers wear.
That's a great way to put it. They also saw inflammatory fibroblasts wearing a uniform called PU.1, but as they tracked the biopsies at 1, 6, and 12 months post-CAR T, they watched these toxin populations drastically decrease.
Wow.
Yeah, particularly in the deeper layers of the dermis.
Okay, so the rogue B cells are gone, and without their constant chemical shouting, the hyperactive scarring fibroblasts naturally die off or power down. But the tissue is actively rebuilding the egg carton, so who replaces them?
The regenerative architects take over. The spatial mapping revealed a huge multiplication of beneficial homeostatic fibroblasts.
What uniform do they wear?
They express markers like Pi16, TFM, and a combination of TNN and COCH. These are universal progenitor cells, meaning they have a lot of flexibility to help heal and manage healthy tissue.
And where were they located?
That was the most crucial piece of data. They weren't just randomly scattered. They heavily repopulated right at the top of the dermis, clustered exactly at the boundary where the new dermal papillae, the new peaks of the egg carton, were actively being built.
That makes perfect sense. The regenerative workforce localized right at the construction site. But SSC isn't just a skin condition. The systemic part of systemic sclerosis is what makes it so lethal. It turns the lungs and the heart into scar tissue, too.
Yeah, which is the really dangerous part.
So if this fibroblast shift is only happening in the skin biopsy on their arm, it's a cosmetic victory, not a life-saving one. How do we know this whole body factory reset is actually happening in the internal organs?
That was the critical question. And since you obviously can't casually take sequential biopsies of a patient's lungs over a year, they had to rely on a highly specialized imaging technique called a 68-gallium FVI PET-CT scan.
Okay, let's unpack how that actually works because it's brilliant. A PET scan uses a radioactive tracer to highlight specific biological activity in the body. In this case, the tracer is FAPI, which stands for fibroblast activation protein inhibitor.
Right.
So basically, the tracer is designed to chemically bind directly to those bad hyperactive myofibroblasts. So if a patient has active scarring happening in their lungs and you inject this tracer, their lungs will glow brightly on the scan.
Precisely. And before the CAR T therapy, that's exactly what happened. The baseline scans showed massive FAPI uptake in the patient's lungs and joints. It highlighted the active systemic scarring.
And after the treatment?
Just 3 to 6 months after the CAR T infusion, they ran the scans again, and they saw a rapid, massive drop in FAPI uptake across the board.
Wow. So the radioactive tracer had nothing to bind to.
Exactly, because the systemic fibroblast activation had essentially shut down. The clinical data backed this up too. The lung function of these patients stabilized or even slightly improved. It proved that this transition from a scarring workforce to a regenerative workforce was happening systemically.
Let's do a second quick recap for you listening to organize these mechanisms. 1, CRT didn't just remove the B cells. 2, it caused a massive workforce shift, firing the scar tissue building myofibroblasts. And 3, it hired the regenerative architects, which was proven both in the skin and the lungs.
Yep, that covers it.
But here's where I think the biology gets truly mind-bending. A fibroblast is a construction worker. It can lay down new collagen to build the peaks of the dermal papillae. But a papilla isn't just a mound of collagen.
No, it's highly complex.
Right, it's a complex ecosystem. It needs blood supply, it needs nerves. If you build a new neighborhood but forget to lay down the water pipes and the power lines, the houses are useless. How on earth did the body rebuild the infrastructure?
This is where we see the true power of the body's innate regenerative programming. To rebuild the water pipes, the blood supply, the tissue underwent an explosion of angiogenesis, which is the creation of new blood vessels.
Oh, wow. How do they see that?
The researchers used techniques like capillaroscopy and optical coherence tomography to look directly at the living skin, and they saw a genuine increase in capillary density and blood perfusion by month 12.
How does a cell actually know to build a blood vessel, though?
It's all about chemical signaling. When the researchers sequenced the genes of the endothelial cells, those are the cells that physically form the walls of blood vessels, they saw a massive spike in signaling pathways driven by things like VEGF and IGF.
Okay, VEGF, vascular endothelial growth factor.
Exactly. VEGF is essentially a chemical blueprint secreted by cells that says, hey, we need a pipe here, start building.
So the dermis is building the structural peaks and laying down the blood vessels, But what about the epidermis, the outer layer? It has to coordinate with the dermis to dip down and form those valleys of the egg carton to interlock perfectly. Are the different layers of skin actively talking to each other?
Absolutely. What's fascinating here is how they mapped that crosstalk. The researchers discovered that the basal cells, the very bottom layer of the epidermis, were sending intense chemical text messages to the suprabasal cells above them.
Using what kind of signals?
They used proteins with names like BMP and HSPG. Mechanistically, these proteins instruct the epidermal cells to re-stratify, telling them to organize and grow downward to meet the new dermal papillae pushing up.
It's an incredibly synchronized dance. The dermis pushes up, the epidermis reaches down, the VGF signals orchestrate the blood vessels growing into the new space. But what about the nerves, the power lines that restore the sensation of touch? Because neuroregeneration is notoriously difficult in adult mammals.
It is, which makes this finding so remarkable. The spatial mapping detected a significant increase in Schwann cells within the newly formed papillae.
And Schwann cells are the ones that wrap around and protect the nerve fibers, right?
Exactly. They are specialized cells essential for nerve survival and function. And these Schwann cells were actively communicating with the surrounding fibroblasts and the epidermis using a specific protein called MPZ, or myelin protein 0.
So the tissue is actively coordinating the regrowth of its neuronal network.
Yeah, this heavily implies that the tissue isn't just laying down random collagen, it is rewiring itself to restore actual sensation and function to the skin.
So what does this all mean? When you put all of these mechanisms together, it completely reframes how we think about treating chronic, severe diseases. We aren't just looking at a drug that acts as a roadblock to slow down a disease process.
No, it's far beyond that.
By utilizing a highly targeted living drug, the CD19-CAR T cells, to drop a smart bomb on the rogue B cells. This therapy cleared the smoke. It silenced the continuous corrupted signals that were forcing the tissue to scar. And the moment that interference was permanently removed, the adult human body didn't just sit there.
It went to work.
It actively rebooted a dormant, whole-tissue regenerative program. It fired the bad workers, hired the good ones, grew new blood vessels, rewired its nerves, and successfully rebuilt complex, functional, 3D skin structures that medical textbooks have insisted for decades were lost forever.
It genuinely forces us to entirely rethink the limits of human biology. The fact that the skin and the lungs can execute such a profound biological factory reset simply by radically altering the immune environment is staggering. It proves the blueprints for healthy tissue are never truly lost. They were just being shouted over.
Which leaves us with an incredibly provocative thought to ponder as we wrap up today's deep dive. For you listening, think about this. If we can trigger this kind of profound biological factory reset in the skin and lungs of systemic sclerosis patients simply by completely eliminating the rogue B cells, what other supposedly irreversible fibrotic diseases across the medical world might not be permanent after all?
It's the exact right question to ask. Could the deadly, supposedly permanent scarring of liver cirrhosis, or the irreversible stiffening of heart failure, or idiopathic pulmonary fibrosis, could they just be waiting for us to find their specific immunological reboot button?
Imagine a future where a diagnosis of permanent organ scarring of your body literally turning to stone is just a temporary reversible state. Thank you for joining us on this deep dive. Keep questioning the dogmas and keep pushing the limits of what you think is possible.